Hi, welcome to the course. My name is Fuad, and this video series will help you understand your reading material, assessment, and health professions education. Now, I'll point out to you in this series what's important, what's not so important. So, let's go right to it. Hi, and welcome to the second class in our course, and the reading for this class is the second chapter, which is validity and quality. Now, this concept of validity and related to it quality is very important, one of the most important, if not the most important thing that we need to understand in assessment. In fact, it is called the maybe the raison d'être of assessment, and you will understand later that almost all the things that we do related to assessment, all the activities from blueprinting, item construction, vetting of the items, uh, calling for external examiners, item analysis, all the whole shebang is related to validity, where we want good validity for our assessment, right? So it goes on to explain the foundations of validity, and basically it is why we do assessments. What is the value, what is the thing attached to that number which the candidate gets. For example, I take a test and I get 60. Let's say that is the final year professional professional exam for a medical course. I get 60%. My colleague gets 40%. Now, what does that mean? We hope that it means that I am competent enough to be to graduate, to work in a hospital, to care for patients and manage, whereas my colleague who got 40 is not competent enough. He must retrain. Okay, so people will ask, how sure are you, what are your evidence that that 60 represents good medical competence? um, how do you arrive, what questions do you ask in your assessment, what are the activities they do in the assessment, do they just sit for paper-based assessments, are their attitudes assessed, are their professional skills assessed, are their clinical skills assessed adequately. If we go back to our uh, previous discussion, why are you taking measuring this attribute? Um, is the attribute of problem solving, is it important in medical competence? How many questions have you asked? Show me which areas which you have sampled. A lot of we can ask a lot of questions, and all these questions, and when we answer them, becomes our proof of the validity of giving me that 60%. Okay, so that's the foundation of validity and its discussion, and which is different from previous concepts of validity, where we just say validity means we are measuring what it's supposed to measure, which implies objectivity. We are measuring things as objective as possible, but newer discussions of validity incorporate things like values, things like purpose, things like assumptions, and things like that. Let's go on. Okay, so it starts off after the short introduction, the principle of purpose-driven assessment. Again, it mentions the assumption that validity means objectivity, and he explains that that is not the case, right? Because even when you are measuring something which appears to be very objective, a length, when we ask questions about it, why, what tools are you using, which part of the stone that you will use to measure the length, why not this way, why not this way, who does the measuring, then that measurement which we thought is straightforward, objective, then it become then we realize that, hey, it might not necessarily be so. All right, so he goes on to emphasize that we need to be clear of purpose, right? Although uh, so in the next page, page 18, uh, he goes on to explain why assessment should not just be an objective measurement. Okay, second paragraph from the top. The appropriate way forward is not just to be more objective, okay, in the abstract, as if we could or should eliminate all our values and our goals for conducting assessment. Rather, he goes on to say, we should be reflective about our values and goals. Okay, and he goes on to say, assessment in health professions education is always first and foremost instrumental. It is a deliberate intervention we take in the world meant to accomplish some goals. So it is not a sterile process, right? It always incorporates measures, values, because we are humans. Okay, and in summary for that section, in the final paragraph for that section, it says, so we might say that a good assessment indeed measures what it is meant to measure. Now that's the old understanding, but most importantly that it helps us to achieve our specific goals with reasonable expense and minimal negative outcomes. So things like expense, how feasible, how much does it cost, that also part of validity concept. Okay, and he introduces the concept of quality. So he says, for this chapter I will define assessment validity as the extent to which an assessment system supports valid inferences about attribute meant to be measured. So he talks about inferences. So we talk about evidence to support our claim that this assessment is valid for clinical competency, for example. Okay. Uh, More broadly, he introduces the concept of quality now. Assessment quality is the extent to which a given application of an assessment and use of its scores leads to outcomes that are positive on the balance given one's values and goals. So what he's saying is that the value, the numbers, always needs to be looked at as something that will interact, it will have impact, it will have outcomes, and we hope that the outcomes, the impact will be positive.